Okay, well, welcome everybody. My name is Jeff Bontrager. I am Director of Research and Evaluation at the Colorado Health Institute. I'm really honored to serve as the Principal Investigator on the evaluation of the Colorado Health Access Fund. And welcome everybody to what is going to be a great panel discussion on program sustainability today. We really appreciate you joining us. We have people joining from all over the state of Colorado, and I think it's really going to be an engaging session. As you all recall, we had originally scheduled this panel as part of the Grantee Learning Circle that we had scheduled back in October of 2019, which unfortunately we had to cancel due to the weather, but we wanted everybody to be safe for traveling to Denver. But we did feel that this particular panel was valuable enough that we wanted to reschedule it and offer it in the future. So we decided to offer it virtually, and we really appreciate Vanita and the rest of the panelists making time today to reschedule and to participate on the panel. A couple things that I wanted to just note is that we are recording this session, and so I will follow up afterwards with a link to where the recording is saved so that those who could not join us today can watch it at a later time. Also that everybody is currently muted right now, and we have intentionally muted everybody so that we can cut down on the amount of background noise on this call. So if you do have a question or comment throughout the session, please send that to me, or you can send it generally through the chat feature on Zoom. And that chat feature is available if you kind of hover over the bottom part of your screen. Black bar at the bottom of your screen should pull up, and you can send a chat that way. So I will be monitoring that throughout. Right now, what I'd like to do is introduce Christy Kaolikai, who is the Director of the Colorado Health Access Fund, and she's going to give a welcome. And Christy, just give me a second to unmute you. Okay, you should be unmuted now, so go ahead.
Great. Thanks, Jeff, and hi, everyone. Thank you again for joining us today. Back in October, it was a interesting snowstorm that sort of hit all over Colorado. And Jeff and I were sort of panicked on that Saturday and Sunday, realizing that many of our rural, all of our rural partners would not be able to make it to Denver. We could have had a metro-focused learning circle, but that's just not who we are. And as Jeff said, we thought this was so important because this is one of the crux of the fund, is sustainability. It is critically important that these services live on after the short-term nature of the fund ends. We are really pleased that Vanita Curry is our moderator today. Vanita has a passion and energy for behavioral health that truly cannot be contained. She's not only a statewide advisor to the fund, but she's also on the board of Mental Health Colorado. So Vanita, thank you for doing this today, and I also want to thank CHI and the panelists as well.
Great, thank you very much, Christy. And so with that, it is my pleasure to introduce Vanita Curry, who is serving as our moderator today for the panel. Vanita is a senior associate at GBSM, and GBSM is a consulting management and public affairs firm. And at GBSM, Vanita works in lots of different areas, including community relations, designing community surveys, advising grassroots organizations, leading statewide health programs, and designing and executing public engagement campaigns. Vanita is also the founder and CEO of the Curry Consulting Group, and as Christy mentioned, she is a member of the Colorado Health Access Fund Advisory Committee, as well as chair-elect of the Mental Health Colorado Board. And prior to all of that, Vanita led a statewide health initiative to change the eating habits of 600,000 students in 98 school districts across Colorado as part of Live Well Colorado. So in all of Vanita's spare time, she agrees to do things like this in moderating this panel. And we are really pleased to have you here today, Vanita. And with that, I'm going to turn it over to you. I will mute myself, but we'll check back in as questions come up. So I'll let you do the introduction of the rest of the panel.
Thank you so much, Jeff. And thank you everyone for being with us today and helping us pick apart that question of sustainability. I'd like to first introduce our panelists who are going to be joining me on this topic. I'd like Desa first to introduce yourself, your title, and what organization you're with and what you do there, and then Samantha, and then Janina. Desa.
Okay, and for those of you who are on the panel, if you are currently muted and you can't unmute yourself, I can probably do it from my end. So it looks like you are unmuted. Okay, great.
It just took me a little while. So it's my first panel via Zoom. So everybody's just going to have to be so patient with me this whole hour. It's going to be crazy. I'm Desa West. I'm the Vice President of Community Impact at the Denver Foundation, where the Colorado Health Access Fund is housed. And my work is really about the foundation's nonprofit focused activities. So the kind of full set of grant making that's done under the direction of foundation staff, impact investing, leadership development, technical assistance, all of those things live in the work that I do along with a really stellar team that includes Christy Kealakai, who you heard from earlier.
Great. Samantha. You need to unmute.
There we go. I'll get used to it, just like Daphne did. My name is Samantha Kumana. I'm the Chief Administrative Officer for Health Solutions. We're a community mental health center in Pueblo. So my job is usually, actually I used to be a clinician, then I just didn't want to be on call, so I got into quality improvement. So right now my job includes quality improvement, taking care of the front desk staff. I also work with peer recovery services. So we have a drop-in center for clients with mental illness and a few other things. I'm very thankful for the 3 grants that Health Solutions got. So I'm excited about this because I think we have some projects that will show you how we became sustainable, and I'm excited to talk about that.
Thank you, Samantha. Janina.
Buenos días a todos. Good morning, everybody. Hi, I'm Janina Fariñas. I'm the CEO and founder of La Cocina. We are a nonprofit organization based out of Fort Collins, but actually serving a large portion of the state of Colorado in providing culturally relevant Spanish language mental health services to the Latinx community. I'm also really excited to be on this panel because I actually really grapple with the question of sustainability. And as a new nonprofit, we're only 3 years old. We have adopted actually a model that I'm excited to share with everybody. Yeah.
Thank you so much, panelists. Desa, I wanted to start with you. I did some homework and I found out that there's a lot of foundations that are limiting their own lifespans, that there's a new idea or a revival of an old idea to do the greatest good in the shortest amount of time. And so Bill and Melinda Gates have dedicated that they're going to spend down their funds like over the next decade. And so multi-billion-dollar foundations have followed suit. And so it struck me that the Denver Foundation found themselves in that situation with this anonymous donation of $40 million for the Access Fund, and that it had to shock your system because you had to do things in a different way, and therefore your grantees also had to perform in different ways. How did that shift? What happened behind the scenes when you started to try to offer this kind of funding?
I think you're exactly right to say it was a shock to our collective organizational system. Most of the funds that we house at the Denver Foundation are meant to last in perpetuity. We have kind of the exact opposite philosophy of some of the foundations that you mentioned. And it really caused us to have to get going in a little bit different way. I would say initially, and for any of the folks who are on the phone that were with us at the beginning of the fund, we jumped right in. We were kind of in a flurry of activity, feeling like we couldn't kind of sit back and plan in as mindful a way, because we needed to get these dollars out the door if we were going to be able to really expend them over an 8-year period. We had to take a pause after a couple of years and say, if we really want to do something that creates the most impact with this fund, we actually do have to be very thoughtful, very mindful. We need to know kind of running in many, many different directions. But we need to stop and we need to think about questions like sustainability, like the way that our funding can create change that's then lasting over time in the community. And so we started to do things like consolidate our grant making much larger grants, and we're used to making grants over multiple years, and being thoughtful about how many years, right, what that looked like from a sustainability perspective. And really importantly to us, and you'll hear me say this throughout, that we were looking for grants that had an opportunity to find a sustainable funding source beyond philanthropic dollars. And that's been something that has been really important to us for many of the grants that we've made over the life cycle of the fund. And I think will continue over its last couple of years.
Janina, I wanted to ask you, with these changes that the foundation had to institute with this anonymous fund and having the clock start ticking before it even got off of Desa's desk, how are you dealing with knowing that the fund was limited as far as the time and looking towards the horizon of creating something that's sustainable? How did you balance that pressure and that passion?
Well, I actually think that the pressure is really no different between the situation with the Denver Foundation and the Colorado Health Access Fund and other funding sources. I think actually kind of the weight of who is responsible for sustainability, if you would, or the question of who's responsible for sustainability is one that I think we all need to grapple with. And so this is one reason why this panel is so important. But then the other piece is that, let's say you are on the receiving end of the funds, really all funding comes with this caveat that it may end at any point. So I don't think the pressure itself is different. I think one of the things that is different, and I know that we will miss very much, is the fact that this particular funding was very much earmarked for clinician dollars. And that is unusual. I think there are so many different foundations, particularly, so we serve a mostly undocumented community. We serve people of color and many undocumented immigrants. And the dollars that are available to do specifically clinical work for underserved communities are really very few. That funding pot, if you imagine funding kind of as a funnel, and at the very bottom of that funnel is a small pot available to people of color and projects for people of color, I think that that's the piece that starts to really get pressured, if you would, if we are going to use that word. Because in fact, that pot is already small. And then if you have the Colorado Health Access Fund come in with something equitable, like let's fund clinician dollars, and then that disappears, well, we just haven't had enough time to build an infrastructure for that. So I would say that's the part we will miss the most and the most challenging part. But in terms of the actual dollars being temporary, if you would, I think that's the piece that we really do have to address, is how do we create that sustainability in a way that, CEOs like myself don't have to stay up at night trying to figure it out.
Right. Yeah, one of the things that we had talked about was the sustainability is not always dollars, it's staffing, it's communication, it's marketing. I think people so often go towards looking in their wallet and not looking at the resources that they need. Do you think that that's true?
I think that's exactly true. And, for example, when we talk about specialized labor, specialized clinicians that can really serve the populations that we need to serve, that are most affected and impacted by some of the crises that we're seeing in our society, then I think sustainability becomes an issue of equity more than it becomes an issue of anything else. I don't think it's actually a good idea to uncouple those two. I think when we do, I think we get into funding streams that create sometimes more problems that are worth. And so I think that's the piece that maybe is really hard to digest, because this fund had a more equitable lens and was trying to fund both traditional and non-traditional clinical dollars. And so I think that's the piece that I would like to see more dialogue about, actually. And I would like to be in dialogue with the foundation about how do we keep that going, even if that funding stream disappears.
Well, I was shocked when we were talking late last night, about how much more money is given to clinicians from private organizations or businesses in the fight for that expertise and to keep them working in communities that really need them is almost insurmountable. Can you talk about that?
It's almost impossible. Yeah, that's right. So, right now, I was sharing with Benita last night that we offer all of our services in Spanish. And I hear a lot of people say to me, I don't know how you're sustaining that part of the work when there aren't enough Spanish-speaking clinicians. Well, in fact, as a general rule, we haven't had a lot of issues bringing in Spanish-speaking clinicians. What we are finding now, however, is that there is a movement by private corporations like the detention centers, for example, to bring in clinicians. So right now, a detention center is offering a clinical psychologist $125,000 a year, a bilingual clinical psychologist, so a Spanish-speaking clinical psychologist. Well, we can't compete with that. There is no way that we're going to be able to compete with that. Yeah. So for us, the issue of sustainability really moves into the area, because if you give me the funding, but then I can't find somebody to fill that position, it's also not sustainable. Right. And so I think we're really right now in part of our model includes how do we build that capacity? How do we build that capacity in an equitable way? And how do we actually put pressure on funders to take a look at the issue from a much wider systemic lens that allows people of color who want to become clinicians the opportunity to be able to work in culturally relevant models? Yeah. If the education you get at the university never translates sustainably into workforce opportunities that support those cultural pieces, then chances are your organization is not going to be able to retain those clinicians.
Right. Well,
so it's a whole feedback loop.
Oh, yeah. And I think we are so happy to have Samantha on, because she's going to talk about how she was able to use the Access Fund dollars as seed money to become sustainable in a very clever way. Samantha, we were talking about your telehealth services. You're out of Pueblo and you really needed educated, quality therapists to help you in your program. Could you talk about how you were able to pull off having a sustainable program based with the seed money from the fund? Oh, you have to unmute.
I thought I did. Thank you, Benita, for reminding me. So our center actually has 3 counties. We have Pueblo, Trinidad, Las Animas, and Huerfano counties. And Pueblo is kind of in the middle, urban, rural, but definitely our cities of Walsenburg and Trinidad are rural. So this was in 2014, and we were having a hard time finding psychiatrists. So we applied for this grant to set up a telepsychiatric service in Mount San Rafael Hospital in Trinidad. So this was the first time we had to do telepsychiatry. We didn't know the rules. We didn't know what the risk factors would be. And then, if you find somebody in Colorado, that's great. But if you don't, which rules do you follow? Do you follow Colorado state rules for psychotherapy, and psychiatric services. So there was a lot of research done. We finally hired someone from out of town, from Wyoming, to provide these services. So that was kind of our creativity to be brave enough to go hire from a different state. And I think one, we were very lucky to get Dr. Shanklin. She has an amazing personality. Sometimes in her sessions, clients will lift up their cat or dog and introduce, their pets to her. So the reason why I say that is because it was so seamless to do this telepsychiatry. It felt like people were in the same room. So I think that was a big sustainability issue, is not to worry about where the doc comes from. We'll figure out the rest. Let's just fill the need first. And then it was kind of an incubator for us to have that program. It made us think about various needs. So we now have 5 teleprescribers from Wyoming, Alabama, Northern Colorado. In the last year, we served around 800 clients via telepsychiatric services, and about 9,000 services were provided. And we're in 2020 now, but our grant ended in 2018. So we've made this sustainable for the last 2 years. Any specific questions?
So you made it sustainable. Can you talk about the sustainability Rubik's Cube that you solved? You found the clinician, you had the population that needed those services. Can you talk about why it is sustainable, how it's become sustainable?
Sure. So, you talk about funds. So first we have to make sure we get the revenue for it. And we looked up all our billing regulations for Medicaid and other programs. So we actually found some really great billing codes we could use. So we started testing them out. We had to learn the documentation for it, and we had to make sure that it went through the claims system. So I think finding those billing codes and getting off the grant money and getting into actual payer world helped us a lot. The other thing is, it's to get the buy-in, right? Really, at the end of the day, we had to get buy-in from the clients to sit in front of a camera and talk to some kind of a strange person, right? It's almost sci-fi. Mm-hmm. So, we had to kind of educate and say, hey, this is not one being recorded. 2, it's just like being in the same room. If you want to walk around, go ahead and walk around because the doc can still hear you. So a lot of client hand-holding education till they became comfortable with it. So this is the non-funding piece where, you have to have the right people, you have to address client issues. We had to get buy-in from the hospital. So our doc actually walked around and met all the hospital staff. We got buy-in from the PCPs and the ERs. So I think that's part of the sustainability, is not just figuring out where the money is going to come from, but just having people support us.
Thank you so much, Samantha. I did some more research and found out through the Center for Effective Philanthropy, they conducted a survey and they found a key indicator of sustainability is honesty. The center interviewed the CEO of a nonprofit who said, I'm going to quote, "With a less secure relationship with a funder, I am reluctant to share needs because I am afraid they may be perceived as weaknesses that would impact future funding." Janina, how have you wrestled with that power dynamic of being vulnerable and open about your needs and the fear that it's going to somehow come back as a negative?
I think for us, we just had to make the decision at some point that we weren't going to make decisions out of that fear, that we were simply going to acknowledge our own fear and then move forward and be very honest with our funders. Our hope actually is that we are able to build relationships with our funders to the degree that we can have those difficult conversations and we can say, can we please be thought partners instead of, and address the power dynamic and hopefully share power in that way. But then once again, I think when you put this in context of sustainability, it's once again an equity issue, right? There has to be an active listener on the other side. I think for us, our relationship with the Colorado Health Access Fund has taught us to some degree that that is possible.
Yeah.
Because I have to say, in all honesty, I have enjoyed a very honest and open relationship with our program officer, and someone who is a learner more than who is looking to kind of impose a set of power dynamics on us. So I think that is the shift, and that is the necessary shift.
Yeah.
Now, that does require, on the side of the grantee, it does require an act of courage to be able to say, I'm going to go for it. I'm going to have this conversation about equity and about power and sharing power. And if you can go there, I think that, yeah, it's a risk, but it's probably a risk that we all need to take so that we can actually share power.
Yeah, yeah. Desa, you know, grantees do need to be honest about what their needs are. And I'm wondering, you know, how you and your team have been able to navigate those discussions between what your funder is saying and what they actually need.
You know, it's such an interesting thing. When I worked in the nonprofit sector for 20 years before I came into this role 3 years ago, and I can remember feeling exactly the kind of pressure that you're talking about. And what I actually found when I was in the nonprofit sector is that the more open you were with funders, the more responsive they were to being your partner in the way that Janina is talking about, to helping figure out kind of unique solutions. I, in fact, sometimes lost funding because I had funders say I was doing too well in diversifying resources. So, I mean, I guess the first thing I would say is, you know, I think from the Colorado Health Access Fund's perspective and the Denver Foundation's perspective, being in that partnership space and really having a dialogue about what you need as the first step towards us being able to really think about what are the many ways that we might be able to support you. And sometimes there may just be, you know, it may just be sitting as a thought partner, but sometimes it may be other things. You know, we've been able to come together with bridge funding for some capital projects. We've been able to provide, we have a whole technical assistance grant program. So we've been able to provide resources for, you know, resource development planning, but also some of those other things that you were talking about that are so critical, you know, communications, staff development, you know, those kinds of things. And, you know, even just something as simple as, you know, giving folks time, you know, we've been talking about that time to get the infrastructure in place to build, you know, really thinking about what those, what the structure of our funding looks like in a way that is most helpful to our partners in this work, because that's really how we view grantees is as partners. We're coming up underneath the really good work that they're doing, and it's to all of our benefit in terms of community impact for that to be successful.
Yeah. Jeff, I want to check in with you to see if we've got any questions pending from our audience. We'd love to hear from them.
So far, no questions have come in via the chat. I do have a question, though, for the panelists. Whoever would like to tackle this, if it's relevant to your community. I'm wondering what the role of your organizations have been in some of these community efforts to really try to establish special districts or maybe new taxes or policy changes that might go towards funding behavioral health services. We saw in 2018, I believe, about 11 or 12 different communities around the state successfully pass new initiatives that support behavioral health in some shape or form. And so I was wondering how that plays into your calculus around sustainability. And I think my question would be specifically for Janina or Samatha.
Oh, Janina, you need to unmute. Unmute.
Yeah, okay. Famata, do you want to go first?
I could talk to it a little bit because I have not been involved directly into the community activity, but we're always at the table because that's what happens in small communities, right? We all wear different hats. We're always at the table. So we've been involved with the marijuana tax dollars. We got some money from it, and we used it for prevention, early intervention services for youth. With the state hospital, there are so many programs that come out of it. So I know I'm talking generally, but I just want to say, I think being in a small community, you're at the table, and I cannot even remember the number of committees we've been on.
So for us, because we serve a very vulnerable community of all really people of color, and because we have a mandate within the organization as part of our mission to lead by people of color for people of color, I think for us, this particular question is really one of advocacy. So when, we do have actually one of these districts in Larimer County. So last year, actually almost 2 years ago now, at the county level, we passed a bill that would allow for a certain amount of tax dollars to come into mental health services. Now, really then the question becomes, so if there are $15 million available for mental health services in a county, the question then becomes is, how are those dollars going to be distributed equitably? Which again is an issue of sustainability. And so for us, what really became important is to do some community organizing around community members being able to very verbally and openly express their need for equitable funding by those dollars or with those dollars. So that's an ongoing effort for us. That's by no means done. The priorities for those funds are set at least for the next 3 years. And so in fact, to go into those priorities and to say and to demand to know how are you going to make that spending equitable takes an effort on the part of organizations like ours and also on behalf of the community. So we have an active advocacy program dedicated to that. And we have peer mentors and community members who have gone through treatment with us, who are interested in that issue, actively preparing actually to give a presentation to the Behavioral Health Board for our county in the next 3 months.
Thank you so much, Nina. Looks
Great.
like we've got some questions,
you.
Jeff.
Yes, yeah. So we've got two great questions that came in here. One is directed towards Samatha. So it says, I'm curious if you have a nurse or admin support at the hospital to set up the telehealth session for patients served by your telehealth psych providers, or do you have one of your staff members embedded there to set those up?
Sure. We do have clinicians, so we don't have an admin at that location, but the hospital staff help us out, and we have clinicians who help set up.
Great, thank you. And one thing that I will do after this call is I will send out a follow-up email that, if it's okay with the panelists, includes their contact information. So if you do have specific questions about any of the programs that you've heard today, you can follow up directly offline. We do have another question that came in through the chat feature, and it says, I'd like to hear more about strategies for recruiting, selecting, hiring, and retaining Spanish-speaking clinicians in safety net practices, especially characteristics that would reveal themselves in an application process. Janina, do you want to take a first crack at that question?
Sure, I'd be happy to, yeah. So I think, in typical clinician style, I would answer that question with also a question, which is, I would be really curious to understand at the supervisory level, what is actually the demographic composition of the people who are providing administrative and clinical supervision. And by that I mean is how diverse is that pool at your organization. So if you, for example, as an organization, are not really reflecting the values directly of the community in the staff that is leading the organization, both clinically and administratively, it's actually going to be very difficult to both attract and retain Spanish-speaking or Latinx therapists. And then you probably will likely see a high level of turnover in that pool. So one of the things that we have done when we do actively is provide some training for organizations on how to build effective supervisory capacity that also reflects that cultural relevance desire. So the cultural relevance can't be limited to just provision of services to the clients. It has to also include the relationship between a supervisor and a clinician. Building cultural relevancy at that layer is fundamental to being able to retain clinicians of color and clinicians who are Spanish speaking. Because otherwise the supervisory level work doesn't reflect, and there's no parallel process between those two. So particularly, and I speak from it as a Latina myself, as you try to translate Eurocentric modalities of clinical care into modalities that really apply for people of color, it's actually, you're working twice as hard as everyone else, first of all, and then you're also trying to just figure out, if it doesn't work, how am I going to explain that to my supervisor? How am I going to say, for example, to my white supervisor, what you're trying to tell me to do isn't going to work in my community? So really those lines of training and communication need to be wide open. And then there's this piece about just, does it reflect? So are there enough people of color at the supervisory level where, for example, I as a clinician will see myself reflected there?
You know, this just shows that sustainability comes in so many different forms. Having the right staffing, having the right, guidelines as a business, what you were talking about, Janina, is so critical to sustainability. And one of the things I wanted to dig in a little bit deeper, Samantha, is what have you been doing to become sustainable? There are so many different pieces to the puzzle of sustainability, and you've been doing that with your program, with the telehealth program for the last couple of years, that it is sustainable. But as an organization itself, what are the things that you've been working on to prepare for this sunning down of the fund, and knowing that, getting funding is always such a tricky thing anyway? What have you been doing?
Right. So I talked about the Medicaid billing piece, the payer billing piece. I think that's huge because that's revenue coming in. In addition to that, I think you just have to be brave. I mean, we've been around for so long. Our center has been around for 50 years. Mental health has been around for so many thousands of years, probably, since, we've been in existence. But there's still so much to be done and to learn. So to be brave, I think, is a big deal. For example, we got this great fund for, 3 years, and then we became sustainable. And now we're thinking about kind of aspiring to different things. For example, we're now looking into using LifeSight or Zoom, so the clients can just call in from their homes to the psychiatric appointment. And, we really don't know how much are the iPads going to cost? Do we want to use iPads? How many iPads do we give? Do we give the iPads to the clients? Where's the money going to come from? So I think this is where you have to be kind of brave and say, okay, you know what? I'm going to start with 5 iPads, 5 clients that have said they want to call in from home, and then see where that goes. So I think courage and bravery is important. Then just in terms of, I talked about the community support, but when you're doing something like telepsychiatry, where people are in different places, you even as a supervisor, you don't have that face-to-face contact, right? So we actually fly our teleprescribers down when we have our employee appreciation lunches once a year. We fly them down, we put them up in hotels. The other thing we do is supervision, right? It's not just a phone call. We use Skype a lot. And I have to say, I walked in, I don't do the supervision, Dr. Mary Jane Horgan does the supervision. I walked into a meeting of hers one day, and I was overwhelmed, and I love my iPhone and technology, but there was this big screen, and there were like 6 people there just talking to each other, and it was just a group supervision via technology. So I think thinking about how to let go of the old-fashioned ways of doing things that are going to keep us down in this new technology world, I think will help with sustainability. Like instead of having everybody fly down once a quarter, the Skype, every other week works so well. So we do that. I think the other important thing that people, at least we didn't think of with telepsychiatry, is just the question that somebody asked. It was a great question. Who's going to set it up? If you don't think about it, nobody's going to set it up. So you have to tag someone to set it up. You have to draw out the process to make sure it's a good workflow. Who's going to turn it off? What if the client has a panic attack in the middle of a video session? There's got to be someone outside that they can reach out for help. So all that is super important. Then Janina talked about, Spanish-speaking providers. When you're in a rural area, you might think, Walsenburg, Trinidad, Pueblo, that Spanish would be a high need. Spanish is not a prevalent language because of the culture in Pueblo. It's very different. People are not as monolingual Spanish as they were in Chicago where I worked. So it's kind of hard to find a bilingual therapist. We use technology. We use this program called Voyance, where we can call in and then just everybody conferences in, and you can get some really good bilingual help with that technology as well. So I don't think sustainability is just money. It's process, it's communication, it's being brave and checking out the new world.
Thank you, Samantha. And Janina, I wanted to also get your thoughts about sustainability and how you're preparing your organization for that new great idea of being able to take care of yourself. What have you been thinking about and doing to prepare your organization for sustainability?
Putting our big girl pants on. Yeah, that's right. So I want to echo Samantha. We need that courage, and we need, I think, in addition to courage, I think we need to be creativity oriented. So one of the ways that I think we exercise that creativity is by really thinking about what are the products that we can develop internally that others are willing to pay for. That's really an entrepreneurial philosophy, but it has been a really important one for us. We do serve a really vulnerable community, and we know that the research shows that services for that very vulnerable community are not always aligned with community needs. And so because we seem to have been able to develop some expertise in that area, it stands to reason that we could develop some products there. Is there opportunity to provide training to other organizations? Is there opportunity to really hone in on what the training skills are that other clinicians could really benefit from? So that not just builds capacity very widely, I think, for our state as a whole, but it really creates sustainability, financial sustainability for us, because then we're integrating a more entrepreneurial model into a nonprofit sector, which I think is very needed anyway.
Yeah.
So, and for us, ultimately sustainability is really about equity, is how do we get a place at the table so that we can play alongside everybody else.
Desa, that has to sound exciting to you. Having a partner that's entrepreneurial and thinking about additional revenue streams and using your money as seed funding, I think is something that might be exciting for you to hear when you're meeting with your grantees.
Absolutely. It's pretty phenomenal to watch the just amazing creativity and amazing thoughtfulness we see from our partners. You know, there's things that we're doing as we look at the wind down of the fund and, you know, thinking about how do we structure these multi-year grants? How do we make sure there's not reliance? And can we invest in some of these things that we've been talking about today that are so important to sustainability? How are we thinking about equity? How are we thinking about workforce challenges, right? All of those pieces are things that, that we're trying to do from our vantage point to help make the transition successful and help make our partners sustainability efforts successful. But the way that that really is going to happen is the kinds of things that we're talking about on this call. It's that entrepreneurial spirit. It's the, you know, looking for creative sources of funding, whether that's earned revenue, whether that's other philanthropic revenue, whether that's through some of the, you know, kind of larger government initiatives that Jeff was alluding to earlier. I mean, there's all of these kinds of places, and putting that patchwork together is really complex. And I just have so much admiration and just you know, kind of deep, heartfelt gratitude for all of our partners who are doing the really hard work of thinking about what makes their organization sustainable from a operational perspective and what makes it sustainable from a financial perspective.
Yeah, that was one of the things I wanted to talk to you about is how do you hope to end well? How do you hope to sunset this amazing fund that's done so many great things in our state? What are the things that you as the foundation are thinking through as we begin to see this fund close out?
Yeah, well, I think, you know, certainly some of the things that I mentioned in terms of, you know, the way that our grant making is happening, the investments that we're making that may have the possibility of payback, help sustain investments into the future. And we're also looking at, you know, some things that are creative in our own ways. You know, you know, we have had such a focus on evaluation with CHI over the term of this fund. What we have been doing with that data is really starting to think about ways that we might be able to lift this work up nationally to see whether there are other funders want to come in with us and you know, with a little different source. So there's I think lots of ways that we're considering, you know, how do we wind this down in a way that doesn't just create an abrupt stop, but creates a really meaningful and powerful legacy that either can continue to support some of the really important efforts that are in place now, or can be a launching pad for other things that will also be great into the future.
Janina, I'm wondering if you could help Desa out and give her some advice on how
Yes, please.
you would like to make sure the fund ends well, what she could do, what the foundation could do to position grantees for success as we look at this next year. Love to hear your thoughts about that.
Thank you. That's a really big question. I would say that the dialogue is really fundamental. So making sure that in the next 2 years, there are spaces available for us to crack open some of the pending questions. I think there are so many pending questions that have come up even here. And I think creating and convening spaces for us to be able to bring those to the table and to say, how do we tackle this? I would say that's the first one. Then the second one I would say is having almost like a design approach to the next steps, where we clearly understand from a more collective perspective, like what is the North Star? What are we actually trying to create in the future? I think we need a collective vision for the future, because I do think that this fund created one North Star and now we're shifting that, right? So now it's a different North Star. And I think really being able to together co-design for that would be really useful. It would be a useful reflective space.
Yeah. Samantha, can you add to that? What do you think the foundation should do as it's sunsetting this fund and how they can better prepare grantees for that moment?
Sure. I'll miss it. I think I always feel that anything we do, especially in healthcare and behavioral health, is just a combination of heart and smart, right? I can see that the fund has the heart, you've been smart, you've been able to find all this money. I think staying ahead of the curve may be a good thing. I'll give you an example. I was on a QI board where we had to approve equine assisted therapy. I didn't know anything about it, and I was one of the people that didn't approve it that year because I didn't know how amazing it was. I just wasn't open enough to see, hey, this is the future. This is what we have to invest in. Same thing with EMDR, eye movement, desensitization, reprocessing. You know, there was someone that was like, what are we doing here? It doesn't make any sense. So I think keeping your mind open to what's out there that hasn't become mainstream yet, but has good results, may actually help with getting more funds, I think, or donations.
Thank you, Samantha. Jeff, I want to check in with you. I think we've got another pending question.
Let's see. Yes. So, Janina touched on this a little bit around the entrepreneurship, but there's a question about non-traditional sources of income, like private income or for-profit initiatives or for-profit arms. So, Samantha and Janina, would you like to answer that? Janina, you touched on it with talking about really addressing community needs in an entrepreneurial spirit. Are there other kind of non-traditional sources of funding that you found?
So I think one of the things you touched on, which is having a for-profit arm. So we have a for-profit arm actually. So part of our model includes a for-profit, nonprofit partnership. And in fact, I think for us, an ideal model to look to, which really isn't executable right now because of the way funding streams are allocated, would be something like a social enterprise, where there's clear purpose and mission, but in fact, you know, the funding is multifaceted and allows an organization the possibility of developing product lines. So one of the ways that we do that right now, for example, is we're in the process of co-designing a curriculum with our community members, a 0 to 5 curriculum for Latinx parents by Latinx parents. Now we're really in the starting stages of that, and our parents are really just developing the first draft of that curriculum. But our idea from a for-profit arm is to really grow that curriculum and to put it into a space where other organizations can purchase it. So that's just one example, but that's a really key element for us in sustainability because in fact, all grant dollars are going to come with this caveat of ending the funding in some way. And it's a fair question anyway. So I would say that's one piece, the product development. And then the other piece I would say around creativity and funding is if you do have a for-profit arm, then you can go actually after different grants. Though grants that open up for-profit entities when you have a social purpose sometimes can really support the funding from a nonprofit perspective. So it just diversifies funding in a very, I think, complete way.
Thank you so much, Janina. Desa, I'm going to throw a question out that we haven't talked about. I wonder if you could share your thoughts about what we're seeing in the philanthropic world, where they're shifting to wanting to spend as much money now to take care of needs that are present, you know, in the generations that we're living in, instead of trying to have a long-term impact. It's more of a shorter impact. Like we talked about earlier in the beginning of our discussion, what do you see in the philanthropic world? What shifts and changes are you experiencing with grants and funding of different nonprofit organizations?
I think philanthropy is trying, I think it's in a transitional place, and it's trying to figure out how to use its capital in the most effective way to accomplish its mission. And you know, I think you're right. There's some foundations and other types of philanthropic organizations that are looking at a faster spend down. We have a couple right here in Metro Denver. Gary Community Investments is a good example of that. But I think there's also other things that are happening in the philanthropic world. You know, one of those that we hear a lot about and, you know, we think about here at the foundation is impact investing. So where are there places that capital can be deployed, not in grant form, but in low interest loans that would help nonprofits save money because they would be paying a higher set of interest to a private company. There's, you know, there's things like that. There's partnerships that are happening all over the place. We're in a really strong 5-year partnership with the state of Colorado around criminal justice reform. You know, that kind of public philanthropic partnership, I think, is a space that people are looking at. I think that philanthropy is very curious about this kind of melded for-profit, nonprofit space and thinking about social enterprise and the kinds of things that Janina was talking about and how those things get supported, what we're legally allowed to support, and what we, from the norms that we have in place, are allowed to support. So I think it's a real transitional period of saying, how do we have the kind of impact that we need to have in community because the problems are so pressing right now that this idea of stretching resources out over 100 years feels a little bit false when there's so much just right in our faces and in our community every minute of every day.
Yeah, thank you so much, Daisa, and thank you so much, panel. We were already at the end of our discussion. It went by really fast. I really want to applaud everyone for your great ideas and insight. I hope our audience got some good intel to help them become sustainable. I would like to, we've got 3 minutes left. I'd like to do a quick race around the room to hear your one thing that you would advise our guests to do in preparation to be sustainable. Please give me your best answer, starting with Janina.
2 words: equitable entrepreneurship. That's it.
Samantha.
Everything is a problem. There's a solution for it.
Daisa.
Equity is key and core, not a luxury.
Thank you, ladies. I will hand it back over to Jeff.
Well, so thank you, Vanita, and thank you, panelists. If we were all in a room together live, this would be the point at which we would all applaud. So maybe you all are doing that in your own individual offices on mute. But I just would really like to thank all of the panelists for your really, really insightful comments. This has given me a lot to think about myself, and I hope that it's been valuable to those of you who are grantees of the Colorado Health Access Fund. So as a reminder, I will send out an email probably within the next day or so. We will post this recording on CHI's website, and I will send out an email that has the link to this recording so you can watch it again or share it with your colleagues, and we'll certainly share it with those grantees that were unable to attend today. So again, thank you so much, Vanita and Janina, Daisa, Samatha. We really, really appreciate your time and insights today. And with that, please, everybody, have a great rest of your day, and thank you so much for all of the work that you are doing out in community to expand access to behavioral health services for Coloradans. We appreciate it so much. So with that, thanks again.
Thank you for having us.
Bye.